Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. I'm joined with a very special guest this afternoon, Jamey Edwards. Jamey, please introduce yourself.
Cole, great to be here. I am the current president and chief strategy officer at a company called Coco Home. We're going through a rebranding, so the company will soon be called Cairns Health. But at my core, I'm a serial social impact entrepreneur. Have founded and led multiple companies in healthcare, especially in and around health equity. And previously was also a private equity and investment banker. So I have a lot of investment expertise as well to share.
I really appreciate you coming on. You and me have talked once previously offline and really great conversation. And so I knew right away I wanted to have you on. Your LinkedIn presence, people love the content that you're posting on there. So I really do appreciate it. I want to ask, you talk about investment banking. You're clearly a good leader because you're involved with organizations at a very high level. People speak very highly of you. Why did you go into healthcare instead of making the millions in investment banking?
Such a good question. I don't know, coming out of like undergrad, Cole, that I ever expected to be in healthcare. I have aunts and uncles on both sides that are physicians. My sister is a physician. And I think over time, as you get older, you're just exposed to everything that's kind of wrong in the healthcare system. And so when I was a banker, I started doing some consulting work for my uncle and digging in with him on his emergency room practice and learning, kind of cutting my teeth, if you will, on the provider side of healthcare and seeing all the challenges that they faced every day. And it made me want to be able, like, I always knew in the back of my head that I wanted to be a founder. I wanted to build companies of impact. In college, when I wrote my first business plan in my entrepreneurship course, I was like, oh my God, the power of being a founder, like taking an idea in your head, making it real, making it matter to people in a positive way and have it impact them and improve their lives. Like I became addicted to like that concept. And so I knew I always wanted to do it. I just didn't think I'd be doing it in healthcare. But the more exposure that I had to healthcare and the more work that I did with family members, and the more exposure that I had to it, I realized there were just so many problems to fix. And the system was so big and it's such a scale that it was going to take a village, more than a village, maybe a city or a whole country or the whole world to fix the issues that kind of beset the healthcare system. How can we treat patients like data points as opposed to the unique story that they are? How can we treat doctors like consumables that we as the patient get to use up as opposed to, again, another human being who's trying to take care of us that we can team with to make our care better and improve our own health? And I think there's just base problems like that when we have a nationwide crisis in a physician shortage and healthcare being the number one cause of bankruptcy. Those are glaring issues that something's wrong, and I wanted to be a part of the solution.
It is impressive because you set out to do that investment banking, and then you had this beautiful motivation to improve people's lives, and you found kind of an interesting mix of this entrepreneurship and strategy and finance in working with organizations. You of course went to Cornell for undergrad, and then you got your MBA there as well.
Yep.
So it makes sense, and you've been a CEO, board of directors, president. You've had all kinds of roles, culminating in where you are now, right? Can you explain what your role is and what the company does?
Sure. So I'm the president and chief strategy officer. I'm basically in charge of product roadmap, marketing, operations. I work with my partner, who is the CEO of the business, a gentleman named Andrew Ritter, who was an entrepreneur in residence at Coastal Ventures. And he had worked with Vinod to turn around one other company prior. This is his second company that he is working with. It was a Coastal Ventures portfolio company. And the company was basically a incubation ground for really interesting technology that Vinod thought could impact the world.
Hmm.
And so they started working initially on a technology that was a radar device for patient falls. So using with not wearing a wearable, not wearing an accelerometer around your wrist or a ring or anything like that, being able to detect a patient fall in somebody's home. And then they pivoted that business model or that idea and said, what else could we use the radar for? and they ended up landing on a sleep solution. And we all know how important sleep is on a daily basis and how it rejuvenates us. And they were able to use that radar to detect sleep stages and when people get in and out of bed and track that type of information. And they actually created a cognitive behavioral therapy for insomnia using the intelligent ambient sensing, so the radar and the audio, mixed with a large language model that would then intervene based on putting the patient in context. And so they eventually said, well, now it's time to commercialize those technologies. And so Andrew and I came in, did an asset evaluation, and said, wow, we're onto some really interesting things here, but what are the two most important trends in healthcare today? And that first trend was a rapidly aging population without enough people to take care of them. And the second trend is the home as a center, a locus of care. So we said, what could we do using this tech and how could we deploy it in a way that helped us address those two main trends? And that was really what allowed us to end up with what we're calling our digital care enablement platform and creating an AI companion that takes really complex care plans, makes them simple, and delivers them to the bedside for the patient. And the whole idea, and this is a big thing for Vinode, was to also use the platform to help address mental and behavioral health issues. So things like loneliness of the seniors and making them feel connected. But really, it's about taking this complexity in our healthcare system, breaking it down into behavioral nudges so that patients can adhere to their very complex care plans.
These are not simple technologies, and I think because of that, they have this huge capability for impact, but they're not simple. How much domain knowledge did you have to have about, or have you had to gain about radar and physics and how how it interacts with technology?
Yeah, candidly, Cole's still coming up to speed every day, right? Like drinking from the fire hose on some of these intelligent ambient sensing technologies and how they work. I think what's always separated my career, I think, from some others is that I've always been, once I got into healthcare, I was like a healthcare product person first. I believe in product led businesses. And so when we started here at Coco Cairns, the idea was we were going to go to the market and not build a solution that we thought the market needed, but rather work with the market in collaboration to build solutions that they would actually use. And so one of our initial goals, or the main rocks that we were trying to achieve in the first 2 quarters, was to go out and secure co-development partnerships. And so we went out to do that, and we've signed co-development partnerships. We ended up securing an NIH grant in partnership with a company called IDL to work with Indiana University Health on building out an Alzheimer's use case on the platform. We are working with a company in the RPM and CCM space to help build engagement with their patient base, which is a huge problem in that sector. And then we're working with a senior care company to help people stay in independent living for longer. And so it wasn't so much about me learning radar and technically how it worked. It was learning about what the capabilities of that technology was and how I could deploy them against a problem set in the space. And so I definitely have been drinking from the fire hose and learning about millimeter waves and chirps and what the radar actually sees and the algorithms and the signal processing that it takes to then take that noise and turn it into signal, and then turn that signal into an insight and that insight into something that happens and it can, really builds value on the front line of patient care. So what I would tell you is the learning curve was steep, but it's more about learning what the capabilities of the technology are and then relying on the amazing team that we have to actually deploy that technology in a way that is reliable and scalable.
Yep, that makes a lot of sense. You mentioned how you believe in product led businesses. What's the opposite of that in your mind?
I think there's different types of businesses that are out there. I think, the main two is like you end up sometimes with engineering led businesses or technology led businesses where someone says, hey, we've got this super cool technology. Let's continue to deploy that. And I think, it's kind of like technology finding a solution as opposed to finding out a problem that really needs to be solved and then finding the right technologies to deploy in that situation. And that's more of a product led approach. So, I think it's great to develop technology for technology's sake and push AI as far as it can go and to develop, a widget that does X, Y, and Z. But I think it's much more powerful because there's a lot of great technologies, Cole. I'm sure you've seen this over and over again that are like, this is an amazing tech and it never gets deployed.
Yeah.
right? And it doesn't see the light of day, or it doesn't achieve the impact it could have because no one took the next step of being like, well, great, what's the solution that we're actually trying to solve for here? And so for me, a product led company looks for that solution first, works with the market, really finds out what the market needs and how it can impact the most people in a positive way, and then uses that as the driver of the technology as opposed to vice versa.
Why do you think we've seen the rise in that other type where a lot of companies are creating, chatbots or in some of which are useful, but it seems like the majority of them are not, right? And so that's kind of just utilizing technology just for the sake of utilizing a technology.
Yeah, I think it's such a good question. I think it's getting easier and easier to experiment with these technologies and roll them out, even as a layperson. I have some friends that are like, "Hey, check out the cool chatbot I built," and I'm like, "It's actually really impressive to see what they've been able to do in such a short period of time, or using a certain platform to build out, an AI agent." But I think there's just more to it than that. And if you're going to build something that's reliable and scalable, has proper guardrails in place so it can't be misused, adheres to all of the appropriate regulations, especially here in healthcare, has a proper perspective on safety. Like, it takes more than just a cool technology to do that. But I think people have seen it. Look, there's an AI gold rush happening right now, right? And we talked about a little bit of this pre-call. There's like some AI washing that's happening, where people are, might take a business that uses a small piece of AI as a piece of it, and they're like, we're an AI company. But unless AI is a huge driver of what you're doing, I don't think you can really classify yourself as an AI business. And while AI is definitely a key part of what we do, we use AI, machine learning, large language models, intelligent ambient sensing with radar and audio and all sorts of different things. We really don't consider ourselves an AI business. We consider ourselves to be, a care plan company, and a patient engagement solution, and, a clinical operating system. So while we're integrating those things, and while, the new website definitely is like, Cairns.ai, because CairnsHealth.com was unavailable, we don't consider ourselves an AI first business. We now consider ourselves a patient first business, and a caregiver first business, and a clinical team first business. Like, that's how you solve these problems in healthcare.
There definitely is two different approaches, right? I mean, I know coming out of business school, a lot of people have the goal of just getting acquired, right? When they create a startup. And so it seems like that is not necessarily compatible with with what you're saying, right? Because
Yeah.
we we can't only please our investors. Instead, you're really trying to please the patient. Do you feel like at large the economy, and this has been a debate ongoing for years. I'm sure that this was discussed back when you were in your MBA program. How can we have businesses that are publicly traded, especially healthcare organizations, where the duty is to the shareholder, but
Yep.
at the same time the primary focus is on the patient, like your business?
You know what? It's an interesting question. And the first thing I'll say is, like, I don't know, do you remember the whole Theranos debacle that
Oh
happened,
yeah,
right? If you watched, I thought there was some great content that was produced on, Netflix and Hulu with the documentaries and the fictionalized documentaries. But one of the things that was consistent between them is Elizabeth Holmes, it seemed, always had the goal of like building $1 billion company. Like, that was her goal, right? And so she found a mechanism that she thought was interesting to achieve that goal, which was the drop of blood, and that was what was going to revolutionize the world. Um, whether it's true or not, I think the right way to go about it is, and we talk about this a little bit, actually a lot at Startup Health, where I'm an entrepreneur in residence, where I coach and mentor founders, is that money follows mission, right? And so if you're there and you do want to, like, I never include exit slides as an example in any of my decks. I find them to be the most annoying slide in a investor deck, is when someone's already talking about their exit opportunities or how they would exit the business. Like, it's kind of irrelevant. If you build a great company, exit opportunities present themselves. If you build a great company, clients want to work with you. If you build a great company that has a story bigger than itself, employees want to work with you. So for me, the focus is on really achieving your mission and using that mission to make people's work meaningful. And if you successfully do that and you build that impact in the market, then those exit opportunities present themselves. So the goal is never to build $1 billion company. It might be to impact 1 billion patients. Like that'd be a better goal in a positive way, right? So I think that's the right way to go about it. Remember that, money follows mission. It always happens like that.
I couldn't agree more. No, excellent advice as well for individuals, like myself, really founders. How did you get involved with Startup Health, and what exactly is Startup Health?
So one of the previous companies that I founded, Cloudbreak Health, which was a health equity solution, we delivered language interpreters to the point of care for limited English proficient and deaf and hard of hearing patients. And we did that, grew the company to 3,000 hospitals across the country and millions of minutes a month of usage across 250 plus languages. The whole goal there was that I was going to something called the Startup Health Festival, and I saw this great community of people that I really wanted to be a part of. And so we applied to Startup Health, and it is a community of health transformers. They refer to them as a global army of health transformers who are focused on solving the world's greatest healthcare challenges or health and wellness challenges, and finding solutions for them. And so there are 15 plus different moonshots. The latest 2 moonshots, one is type 1 diabetes, the other is Alzheimer's and dementia care. And these moonshots, the whole idea is it takes a village to solve these problems and that you solve them with great collaboration. And there wasn't a venue really in healthcare until Startup Health came along for people to do that. And so within this community, you join, and it very much serves as a longitudinal accelerator. So they're multi-year programs as opposed to 12-week programs. And you can join the community and be with other like-minded people who help support your founder journey. So if you take a look at someone's founder journey, it's not a hockey stick, right? It's a series of roller coasters with the bottom of the roller coaster or the top of the roller coaster being your milestone. And once you hit your milestone, you realize there's more work to do. And so you dive back down to doing the work and doing the hard stuff. And so these, especially with Startup Health, like they're focused on making sure that their founders maintain their mindset, which is a really key and important thing that founders don't pay enough attention to. They make sure that founders feel supported, that they're educated, that they're networked and connected with people who can help them make an impact in their space. So the type 1 diabetes and Alzheimer's moonshots both have impact boards. Those impact boards are made up of movers and shakers in the industry that can help open doors, give great advice, mentor, coach, and do all those different types of things. So that's really the purpose of Startup Health. And Startup Health has over, almost 500 companies that have gone through the program or in the portfolio. And it's really incredible to see how they work together to create a brighter future for everybody.
Wonderful. Well, I'm going to have to look into that.
And by the way, Cloudbreak was one of those portfolio companies, right, before we merged it into a SPAC and sold it. So, I saw firsthand the value that Startup Health brought to my company. And so I was very focused on then, once I sold, going back and kind of paying it forward. And so I went back to Startup Health to do that and became an EIR.
Wow. I am going to, after the show now, have to look into this because, I want to be a serial entrepreneur for impact. And so I think that's seems like an excellent opportunity. And of course, we'll link to this as well for anyone else who's interested. And of course, link to your company. A lot of our guests are in the health system space, in the hospital space.
Yep.
Clearly hospitals they're trying to solve a problem. So in a way, they're problem led, but at the same time, sometimes they get caught up in other areas. One of those areas, again, as we mentioned, is AI. It was a little disappointing sometimes to see hospitals not always using AI for the most impactful area. Sometimes they themselves create and spend resources on projects that don't have the most meaning. What do you think hospitals and health systems can do to embrace true innovation like what your organization is doing? Is that even possible for nonprofit institutions with 40 or 50,000 employees?
Yeah, look, it's such a good question. I think there are health systems out there that do a great job of innovating. Advocate Aurora Atrium, that organization is well known for their innovation. Intermountain in Utah is known for their innovation. I think actually Kaiser is fairly innovative, and their innovation isn't necessarily on technology, but it's on their care model. And I think the world could learn a lot from that integrated care model and how they take care of their patients. And that's why their latest initiative, Rise in Health, I think is particularly interesting as well. But the lay community hospital who's not Providence or Ascension or any one of those orgs that can't afford to deploy technology and is literally just focused every day on survival,
Right.
has a problem with innovation. And they might need innovation more than anybody else, but like, can they afford it? And is the health system and the reimbursement system, more importantly, built around innovation? And for me, the answer to that is no, right? This current fee for service environment that we have is not built for innovation. And, it's like payers make it so difficult to be compensated for care. A lot of care ends up being rejected, even though it was already given. And doctors on the front lines are thinking they're doing what's right for patients without regard to reimbursement. And then reimbursement on the back end ends to be a problem. So it turns out to be a problem. So I think for me, it's like, if you really want hospitals, we spent, Cole, $4.8 trillion on healthcare last year. Like, that's a staggering number. I think it's half of all the world's healthcare spend happens here in the United States. Man, don't you think we can do better by increase? Like, there's good care in the United States. It's just not equally distributed. And the same is true of the technology that's implemented in these hospitals. Some of these facilities have incredible technology, but others don't. And it's really important that we make sure that we kind of level that playing field over time. I think value-based care can really help make that happen. But we've been talking about value-based care for like 30 years, and we're like 5 or 10% penetrated with value-based care. So still a big opportunity there. But I would tell you that a lot of these hospitals and health systems, can't afford to innovate in the way that we would like.
Do you think that that is why we can't implement value-based care like we would like, is because there's that worry that hospitals won't be able to innovate to meld with it?
I think a lot of the reasons that value-based care hasn't gotten as much traction as we would like is like the healthcare system itself is like super risk averse. So that's an innovation problem in and of itself. Like, how do we build a culture of innovation in a hospital? And, you might want to have Rasu Shrestha on from Advocate Aurora, who's their chief strategy officer over there, to talk about how he has successfully built an innovation culture there. But I think to build an innovation culture, you have to be a profitable health system that has the ability to allocate resources in that way. It is much more difficult for inner city urban hospitals or hospitals that are super rural, that have tough payer mixes, to innovate. And as a result, like, everyone's just using the funding mechanisms that are in place. And I think, by the way, you also have the added complication that it takes a fair amount of political conviction, right, somewhere in our government to change the things that are broken in the system. And, we have Obamacare and the ACA, but that only went so far. And so how do you take the next step? Well, no president really since then has really had healthcare as like a major focus. There have been other battles to fight. Even during COVID was the focus, not broader healthcare, right? And during COVID, we saw a lot of investment in digital health companies and innovation, going through the roof during that time period. But now we're back down to pre-COVID levels. Yeah. So what does it say about all the innovation that happened during that time frame and all those companies that had solutions that weren't adopted and everything that goes around it? I just think right now also hospitals are focused on their electronic medical records, which to me is a double-edged sword. Like, objectively, you can see the value of a electronic medical record, but when you talk to doctors who use them, they're like, the user experience sucks, and I feel like it slows me down, and it intermediates my relationship with the patient because, Cole, instead of me looking at you and talking to you, I'm logging something in the EMR over here. And yes, there are now AI scribes and things of that nature, which are making that experience better, but all the data is locked up in these electronic medical records, and interoperability is still a challenge. And I think those are the obstacles to value-based care. Those are the obstacles to us all collaborating together around a patient to make their life better. I mean, we have a lot of regulation, not enough finances, and technology that currently is really hard to use.
Yeah, it's prohibitively expensive as well because
yes. When people talk about like how much a health system has spent to implement Epic, you're like, what? It's like, it's a big number.
I was gonna say, it's and you can't pick and choose either. No. You have to implement all of Epic in kind of everywhere, right? Yeah, because of that lack of interoperability.
Yep.
Shifting gears, I'll ask a final question or two, but It's about, you were talking about political will in the political system. I want to ask about political will within the organization.
Yeah.
So, Coco Health had been around for, you said, 5 or so years before you came in.
Yep.
Your role there requires you to innovate, and it requires you to make changes, right? That's why, you're brought in as the president and chief strategy officers to strategize.
Yep.
uh, it's challenging, especially for maybe a lot of our audience who are administrative fellows heading into their new role in the health system. You want to make a name for yourself. You want to make positive changes. You want to be good at your job, but at the same time, you don't want to steamroll people. So, how is there any tips on how you've navigated coming into organizations and making positive changes without being overbearing or steamrolling anyone?
Yeah, it's such a good question. And change management, Cole, is always like such a big problem. And anytime a new, I mean, we had not only a new me, but a new CEO as well, right? So a lot of changes at the senior level of this org as they moved from almost like incubation lab to commercialization engine. And those changes, like people don't like change, right?
Mhm.
Even technology software coders like don't like change, right? So from that perspective, we had to spend a lot of time setting up a new innovation culture. And like, what does that look like? Well, I wanted to have a 30, 60, 90-day plan so that I was patient, because I think a lot of times you come in and you're like, we're going to change this and do this. And you come in like a bull in the china shop and you're like just shaking things up and you want to get things on track and you want to put your stamp on the org. And I think organizations are made up of not just you or me, but a lot of people. And it's really important the first thing I always like to do is go in and listen, right? Go in, interview everybody. What were their challenges? What did they like about how the organization was previously run? What do they think could be improved? And then try and be really transparent about it. So we got here, and the first thing we did was like do an employee survey, and we were public about the disclosure of what everybody said. So being transparent, I think, is a really important thing. And then I made it very clear to everybody early on that like my leadership style is to be a servant oriented leader. Like I believe in that, or an enlightened leader, which is like the next level of servant oriented leadership. And so for me, I was like, I view my role here as helping all of you do your job. Like not, and by the way, not just do your job, but like succeed in your careers.
Yeah.
Right. So laying this groundwork to let them know that I was there to support them. Like I wasn't an authoritarian regime from that perspective. And change takes time. And the hardest thing to be is patient.
Mm-hmm.
And so sticking with that 30, 60, 90-day plan, I try to be patient. I'll tell you, even now, 7 months in, we're still doing that really hard work. We still have town halls with the team where they're giving us feedback on things that, that they didn't like that we did, and things that they liked that we did. And I think it's just important to keep that bi-directional communication open, to build trust, because I think that's one of the most important things is like, hey, we trust you guys to do your job. You trust us to do ours, and to build that followership. And we tend to build that followership, at least in the style of me and Andrew, the CEO, in letting people know that we're there to help them.
And that patience is even more challenging when you're 2 years into your career compared to the 20
Yeah.
years of experience that you have. So
Yeah, because you see what needs to be done, right? And you just want to go out there and do it. But sometimes that's not the right instinct to follow. And I think the other thing is like all great business, and I've given this advice over and over again at Startup Health, all great business is about great storytelling. Like if we're doing our job here at Coco Cairns, like the idea is we've built a story that these employees really want to be a part of and they can get behind, that really gives them true meaning in their work. We've built a story that really resonates with clients and shows them that we're really helping them move the needle for their patients or their caregivers or their clinical team. So we're very much focused on like what that story is, and how it falls into the mission and how that can drive meaning for our team.
wow. I'm very impressed. I have notes, and of course, we're gonna take the transcript of this, and it'll give me even more notes. But I really appreciate this. I know this is recorded for our audience, but it's almost like a personal mentoring session as well, and I really do deeply appreciate it. I hope that we can have you back on. We're gonna link to all of your organizations and your LinkedIn here. And then, that way people can check out the work that you're doing. But I couldn't be more appreciative for you spending, a half hour of your time with me today.
Cole, super grateful. Thanks for hosting what are very important conversations. And I'm looking forward to, I learned stuff from you here as well. So looking
Oh,
forward to
thank you.
future collaboration, learning more from you too. And if people want to engage with me, yeah, LinkedIn's a great place to do it. But if anyone has questions about what we do, they can fire me an email or hit me up on LinkedIn or come to our website.
I'm sure a lot of people are going to take you up on that, so be careful.
Yeah, no worries. No worries.
Okay.